Admitting participants in 3, 2, 1. Thank you everyone for joining us. We're just waiting for the participants to arrive at the Zoom room before we get started. Thank you so much for your patience. Thank you everyone for joining us. We're just waiting for a few more seconds for everyone to arrive at the Zoom room. We will start shortly. Welcome everyone. Thank you for joining us at the Regional Dialogue, Accelerating Progress on NCDs, Connecting Universal Health Coverage Regional Priorities with the NCD Financing Agenda in the Americas and the Caribbean. Simultaneous English to Spanish interpretation is available during this session. The feature has already been activated and is available by clicking the interpretation button at the bottom of your screen. My name is Rosanna and I will be your technical facilitator for today. If you need assistance on Zoom, please use the chat function to message anyone with the title Technical Facilitator on their name. Before we get started, I have a few technical notes to explain. Please note that microphones will be disabled during the panel discussion to avoid any interruptions. At the end of the panel, there will be an open discussion and Q&A with participants. If you would like to contribute a perspective, idea, or question during that time, please use the raise hand button at the bottom of your Zoom window, and our team will enable your microphone. You are also encouraged to send your questions through the Q&A box and make your comments and contributions throughout the event using the chat function. You can find all the features of Zoom meeting at the bottom of your Zoom window. Lastly, this session is streaming live on YouTube and LinkedIn to reach a larger audience and is being recorded for documentation purposes. Let us begin. Please welcome Ms. Katie Dain, who will be sharing introductory remarks. Ms. Katie, the floor is yours.
Thanks very much and welcome to today's virtual event, Accelerating Progress on NCDs, Connecting Universal Health Coverage Regional Priorities into the NCD Financing Agenda in the Americas and the Caribbean, co-hosted by the NCD Alliance and the Healthy Latin America Coalition and sponsored by Beatriz. My name is Katie Dain. I'm the CEO of the NCD Alliance, and it's a real pleasure to be welcoming you all today virtually. I think we have around 55 participants online from across the whole region and a variety of different sectors. I'd like to begin by providing some short scene-setting remarks to this discussion before handing over to Beatriz Champagne, who's going to be our moderator for today, who is the Executive Director of the Healthy Latin America Coalition, as well as a new member of our NCD Alliance Board at the global level. So as we all know, universal health coverage is an absolutely critical goal embedded in the UN Sustainable Development Goal agenda. It strives to achieve that everyone has access to quality essential health services, regardless of their ability to pay. And it involves 3 different dimensions: service coverage, the range of packages or services offered according to needs; financial coverage, protecting people from the financial consequences of paying for their health services out of their own pockets; as well as population coverage, really ensuring the whole population is covered by these health services with a really strong equity perspective. Financial coverage, protecting and we know that the only way that universal health coverage will be achieved paying for their is through real financial commitments and the willingness of governments, together with all sectors, to put their money where their mouth is, particularly when it comes to non-communicable diseases. We know that currently that there is a major funding gap when it comes to NCDs. Less than 2% of all and we know that the only way that universal in the past 20 years have gone towards NCDs, which essentially has left low middle income countries managing the financial cost of NCD care alone. And it's a cost that's often passed to people living with NCDs. A recent report from the NCD Alliance and the George Institute for Public Health shows that a devastating impact of out-of-pocket expenses for people living with NCDs in low and middle income countries. And it really brings into sharp relief that continued inaction will only perpetuate the intergenerational cycle of disease and poverty, as well as the growing inequalities between and within countries. The report that I just mentioned also makes it clear that across the world, most people, the people most likely to pay out of pocket, those who are already poor or marginalized, living in rural areas, or the very young and the very elderly, compounding the issues even more. These expenses are frequently catastrophic for individuals and households, pushing whole households into cycles of poverty. Ending this cycle and achieving true universal health coverage really requires meaningful, reliable data for decision makers. It requires creative funding solutions that really capitalize on domestic resource mobilization, official development assistance for health, as well as public-private partnerships and blended financing, as well as always ensuring that people living with NCDs are at the center. With the upcoming Universal Health Coverage high-level meeting in September of this year, we, the NCD community, have a really important opportunity to ensure that the needs and the priorities of people living with NCDs are really reflected in what heads of state and heads of government will be discussing in New York and making commitments around. In April, many of you will have seen that the NCD Alliance launched our advocacy priorities for the UHC high-level meeting, focusing on 4 headline priorities. Number 1, invest in prevention and control of NCDs. Number 2, accelerate UHC implementation by including NCDs. Number 3, aligning development and global health priorities to achieve universal health coverage. This is very much the integration agenda. And number 4, engaging people living with NCDs to make sure that UHC is really people-centered. So today at this regional multi-sectoral dialogue for the Americas and the Caribbean, what we're really hoping to do is bring a region-specific lens to this important issue of UHC and financing for NCDs. We'll hear from speakers from across civil society, from governments, development agencies and people living with NCDs on regional best practice in policy and implementation, and discuss the gaps and the challenges that exist that could therefore form the basis for regional advocacy for UHC and NCDs. Really looking forward to hearing all of the insights and the perspectives heard today. So with that, let me pass over to our expert moderator who needs no introduction to the audience today, Beatriz Champagne, who leads the Healthy Latin America Coalition. And as I said at the beginning, delighted that Beatriz is also joining the NCD Alliance Board as of 2 weeks ago. So over to you, Beatriz.
Bueno, muchas gracias, Katie.
Thank you so much. It's a pleasure to be here as a moderator in such an important meeting. And I would like to say that, as you were saying, I will speak in Spanish, and Agustina Luque, the other moderator, will also speak in Spanish. First of all, I would like to thank NCDA the opportunity to work with them in all the duties that we are doing. And of course, I am honored to be a part of the steering committee. I would like to, I see we have 75 participants here today with us. That's great. And I would like to start mentioning that this is a great opportunity to debate, to talk about the UHC and the financing opportunities that we have. We have a great opportunity to increase these universal, this UHC in all of our countries. There has been a lot of progress, and sometimes we don't realize this happens, but since 2015, since the SDGs were approved, we had some great successes. I won't talk about all of them, but I will give some examples. For example, the tax on sweetened beverages in Mexico. Between 2014 and 2016, the consumption of these kind of beverages was reduced by 7.6, and this is a great achievement. Also, in Colombia recently, a tax on sweet beverages was approved as well, and also a tax on junk food. This is one of the first countries in including junk food in among the products that need to be taxed. We also have the example of Brazil with the excise taxes that tax tobacco, and this is a very good example, and it's a first step. It also represents a new opportunity for other health public policies in Brazil. It opens a door. Sometimes we do not realize that we progress, but we do. When it comes to CSU, there's also been improvements. In the year 2000, 65% of the population benefited of healthcare services, but in 2019, it increased to 77%. And there was also an increase in the investment of the government of our regions of the 1.1%. Also, in financing, sometimes we feel that it is a very difficult field and that we achieve nothing, but that's not true. But we are working and we have progressed in maintaining financing in healthcare during disaster events. In 2019, the Bolivian government launched a program that allows individuals without health insurance to register at the point of service when they need it. This is also that has increased the coverage for people that didn't have it before, excuse me. Chile is also undergoing a UHC reform to create a system that will serve people without financial limits. So these are opportunities and achievements that we have had in our region, but as we know, we still have a lot of work to do. From CLAS, we have a group of people that are living with NCDs, and we meet every now and then to talk about this issue. And it needs to be said consistently, it's the subject of not having enough coverage arises. So we need to consider there is a great financing gap that is making this process even slower. We want to have the commitments of the government, real commitments that can be concretized in our regions and countries. But I am very happy to see that today we have a great panel of speakers that are excellent professionals and that will enable us to listen to their perspectives and insights also of not only professionals and practitioners, but people that live with NCDs. And after listening to two of the speakers, we will have a fireside chat that will be moderated by Agustina Luque, which is a part of my organization. What I would like to do right now is to present to Gabriela Cuevas. She is the person who will be speaking first. Gabriela Cuevas, she is from Mexico, and she's the co-chair of the steering committee of the UHC 2030, and a coalition of organizations that's working towards this high-level meeting that will take place in September in New York to talk about UHC. She is working in the unit that's developing the priorities that are related to this subject. She was a part of the Congress of Mexico and also the president of the Inter-Parliamentary Union and much more. She has a great curriculum as a politician, but also as an influencer in the healthcare field. And so, Gabriela, please take the floor. It's a pleasure to have you with us. Thank you, Beatriz. It's a pleasure to be here today, to be taking part of this conversation, to talk about something that's frequent, but that we haven't been, well, it hasn't received the attention that it should, which is NCDs. The organization that I represent works towards the HLM on UHC, and it's a platform, and we try to influence decision makers in politics, in the private sectors, also in international organizations, in order to create healthcare systems that are stronger to deliver better healthcare. We are here because we do care, because we know and we're concerned that half of the population of the world does not have access to healthcare services. Our platform, UHC 2030, is not only focused on one disease or on a specific issue or subject. No, our principle is that we need to have healthcare that are person-based, that puts people in the center. Along our lives, we all have to face different healthcare problems. And when we talk about NCDs, we realize it's an essential subject because it's increasing every year. It takes away the people of 40 million people, and this figure keeps increasing. In Latin America and the Caribbean, just in our region, it is estimated that 80% of the death could be attributed to NCDs in 2030. These figures are tragic, but even worse, 80% of these deaths that are caused by NCDs could be prevented with a very low cost. NCDs are increasing, as I said, but not only in our regions, but in the whole of the world. And these could be improved by strengthening our systems and by guaranteeing UHC. And so we could fight against NCDs like this. That's why from UHC 2030, we're working with the NCDA to reach global healthcare and the UHC. And I have to say that the NCDA has been a great ally. We have we agree on many things, and we have to face the same problems, but also we have the same strength. And I think in this HLM that we will have in September, of course, we will talk about tuberculosis and infectious diseases, but we also need to be talking about NCDs. We need to talk about everything because healthcare is something that should be an achievement for everyone. Everyone should be able to enjoy these services. And it doesn't matter how many politic speeches we hear. It doesn't matter how many HLMs are held, we need to change our perspectives. We need a shift. Beatriz has been talking about my past as a politician. Now I'm involved in our projects, but I think we need to change our mentality because healthcare is seen as expenses, not as an inversion. An investment, excuse me, and healthcare is an investment because if governments do not invest in healthcare for their people, then which are the priorities? We could even go beyond. If we cannot access healthcare, how are we going to reach higher levels of welfare? So one of the main objectives is to strengthen our systems, and analyzing the proposal that we have, that it's enhancing UHC, we also need a coherent framework to do this. So we need to conceive the UHC as an umbrella that protects all the agendas and coordinates them. We need, for example, a primary healthcare attention that allows us to advance. And we need to be sure that we also need to strengthen our capacity to fight against pandemics, for example. Everything is important. For this HLM for the UN about universal healthcare coverage, the governments need to demonstrate that they care. And that's why we need to be focusing on putting the UHC as the first items in the agenda of the governments. As I had a lot of responsibilities, but I realized that when a politician really cares about something, you can tell when you take a look to the budget. How do you know a politician cares about something during a campaign? Because it's in the budget. Me, for example, if I promise my voters that they will have high quality healthcare, but then I do not include it in the budget, then it means I do not care as a politician and people still won't have access to healthcare. And if we don't change this, if we don't change this in 2030, 5 billion people will not have access to healthcare. And we need to change this. And where are we? In which point are we? And I would like to talk now about a document we have been working in, and it's a review of the commitment of the actual state of UHC. You can find it in our website. And we will ask you, you are very close to people, to organizations, and we would like to ask you to help us to have more information. And this is a good document we offer that offers a good point of view of the state of this question. And it allows us to see how things have changed since 2019, where the Declaration of Universal Healthcare was adopted in the UN. And we cannot be too optimistic because in 2020 we had a pandemic. And yes, we improved maybe in prevention, but it's true that we have the 3 HLMs in September at the UN that allow us to have all the heads of state, heads of government in the same room, speaking about these very important issues. And yes, we're talking about financing, and yes, it's very important, but we need to highlight the regulatory and institutional parts. In many parts of the world, there is a great discrimination, especially towards women and children. So we need to take this in account from the Constitution, and we need to reflect this also on healthcare policies and also in the budgets. In our regions, we say it's very important to take into account the details, but in politics, we say we always need to take a very close look at the budgets. And so through implementation is how we change the lives of people. And that's why budgets are so important, and healthcare and UHC need to be included. Around 5% of the GDP should be dedicated to these to have a much stable transition, but also we also need to involve the private sector to improve technology, also to involve the research sector to make this a reality. Today, yes, we're talking about financing, but it doesn't matter how we talk about this. The poorest people cannot still access medicines and drugs. And as a Mexican, I know how politics can have and these can have an impact on obesity, the detection of cancer. And yeah, we still have a lot of work to do, but I believe the most important that first of all, we understand that achieving UHC, it's a political decision. It's a decision that requires commitment, requires the law, the legislation sector to be involved, decision makers to be involved, and also, of course, the involvement of all of these spheres to have the budget we need and to implement new policies. Of course, it's also very important the role of civil society, especially when it comes to NCDs, because in most cases, they are doing the job, the work of creating awareness, and they achieve very important changes in the expectancy of life, people of their communities. We need to understand that healthcare is not a privilege. It's a human right. It's a human right that need to be implemented by the government. Three of our most important priority is incrementing the levels of public expense to create more resilient and inclusive systems. Of course, this is especially highlighting and strengthening primary care. We also have a priority, as I said, increasing the budget for primary care, but also to scale up and strengthen our healthcare systems for everyone, and also invest more to have a better financial health. And here, the governments need to research and need to figure out how to make budgets and financing more efficient, fighting against corruptions, having better technological systems that allow us to monitor with higher efficient the evolution of people, of the population. I think we have all the elements to achieve it, and I think this is a golden opportunity in September of this year at the UN, not only to debate about these, but also we have the chance of reaching agreements, and we need to write declaration with objectives, with goals, and the role that we have is very important, and it is to monitor the implementation of this declaration. As I said, not only it's important the budget, but also this passion and this care should be present in this declaration that we will make. Thank you again. Thank you, Katie. Thank you, Beatriz. And thank you, everyone who is participating in this session, because we do care about this and we want to make a change. That's an excellent presentation. It's great to hear you and talk about how important is the implementation, because yes, of course, we talk about drafting documents and theory, but of course, implementation is key to achieve UHC. And now we're going to present our next speaker. He's Dr. Jeremy Veillard. He's the Senior Health Specialist for Latin America and the Caribbean in nutrition and healthcare at the World Bank. He used to be a healthcare executive in Canada, and he has worked in offering services also and in research and health services. He has a PhD in public healthcare and investigating healthcare systems from the University of the Netherlands, and he has a master's in hospital administration as well in France. Jeremy?
Excellent, excellent. Merci beaucoup pour l'opportunité, Béatrice, de parler au nom de la Banque mondiale. Sorry, now I'm speaking English, and I spoke French. I can do it in English or Spanish, but I think I said I will speak in English for the translator to make their life a little bit easier. So it's a pleasure today to be speaking on behalf of the World Bank. I'd like to tell you a little bit about the work that the bank is doing on healthy longevity. We have launched about 3 years ago a major initiative that has been supported by Access Accelerated and its partners that focuses on healthy longevity with 3 goals. The first one is to understand the burden of avoidable mortality and be able to put a monetary value on it. The second one is to understand what are key interventions to improve prevention and control of NCDs with the goal to reduce avoidable mortality. And we will look, and we are looking at both multi-sectoral and health sector related interventions. And finally, we're also hoping to mobilize, the bank, its voice, its technical work and its financing and other banks and other partners to advance the agenda. And as a consequence, we're also very much insisting on the importance of improving the measurement agenda. We're really closing off on this work, and we're just about in the next few months to start engaging globally with countries, low and middle income countries, on the issue of health and longevity. And what I'd like to do in the next 4 minutes, just to give you a little bit of some of the highlights of what we found. And there are really 4 points that I wanted to emphasize. The first one is that better health throughout the life course is achievable, but we are also at an inflection point. And I think it's very important to understand that the latest projections from the UN Population Division show us that in 2019 in the world, 58 million people died. In 2050, there will be 92 million people will be dying. So we have a very steep increase in mortality, and that's obviously related to aging. Most of the death will be for people aged over 50 years old. What we've seen as well is that in the first 2 decades of this century, the risk of death before age 15 has decreased dramatically by about 57%. By contrast, for 50 years old and older, the risk of dying has decreased a lot less, by about 27%. And obviously, NCDs and the big 5 that we've spoken about, are responsible for the majority of those deaths, about 70%. Another finding in our study is that there are about 7 in 10 of all deaths, about 40 million deaths in 2019 that could have been avoided. And we know what to do. And we know that some of the most effective interventions, not all of them, but at least we know that, increasing taxes on smoking and alcohol, is very effective and can really help us move forward in that direction. Now, what we found as well is that if countries were able to accelerate their progress through a life course approach, and that means investing very early in a life course to prevent NCDs, we know that achieving for the bottom 80% of the countries, the results of the top 20% would actually avoid or avert about 500 million deaths, 500 million deaths between now and 2050. So that just to give you a little bit, a sense of what that means. Now, the work that we're doing on healthy longevity, NCDs, and human capital is calling for action across the life course. And what that means is that what you want is to invest in prevention of NCDs, and you want to do in the early years, children, adolescents, or young adults, because they are a lot more likely to adopt behaviors that will allow them to reduce dramatically risk factors such as smoking, excess drinking, or obesity and overweight. But we know as well that implementing solutions across the life course is going to take substantial resources. So if we look at this gap and how the bottom 80% of the country can catch up with the top 20%, we know that they will have to spend about $250 per adult age 50 to 69. What we found as well, so we have a price tag for those improvements. What we know as well is that those improvements, not only are they worth saving because they enable improvements in productivity and in economic and societal contribution of individuals, but they also have positive consequences in well-being. They also help reduce poverty, and especially they have a very positive impact on women. That's a very important argument. Now, the third point and message I wanted to show you is really what is it that countries can do. So we've been working, looking at all the evidence as part of an initiative called DCP4. So that's the Disease Control Priorities 4th edition. And we've been able to identify interventions, some of them being multi-sectoral outside of the health sector, some of them being clinical. And we're able to come up with a menu of 22 high priority and cost-effective interventions that are recommended in this upcoming work. What is very interesting is that when we look at the clinical interventions, many of them can be delivered through primary health care. And so that helps with universal health coverage, and that helps with resilience of health systems. We have found also that some of the interventions, and I'm talking, for example, that pulmonary rehabilitation or treatment for chronic heart failure, they are high priority across all country categories. But obviously, the priorities for interventions will depend on financing capacities, and they will depend on the scope of coverage and financing for universal health coverage in different countries. I think it's very important also to understand that this is not only a health issue, it's also about labor market inclusions, about sustainability and efficiency of social protection systems. And obviously, investments in long-term care will be needed to make progress, as will be investments in strengthening country data systems. Finally, let me just finish with a message on financing and really who can do what. We know that there are those investments in NCDs prevention and control early in life. They will deliver very strong returns on investments. The high priority package that we'll recommend will cost about 0.6% of GDP globally, but they will achieve the equivalent of 4% increase in real income. So that's obviously a very good investment from an economic perspective. It's important also to mention that the benefits of life course investments, they are large. They correspond in our analysis to about $3.2 trillion in economic value just in 2050. And the benefit cost ratio, sorry for being a little bit technical here, is at 15 overall for all low and middle income countries. Now, the challenge that we have is to mobilize financing. It has been mentioned that when we look at the analysis of official development assistance, only 2% in the last decade has gone to NCD, I believe. And so it's very important to mobilize countries so that they can invest, but also to mobilize other development partners. And at the World Bank, in addition to all this knowledge work that we've been trying to to bring to life, to be able to engage with countries and convince them to to foot the bill. We're also making our financing available, and we're also working with the private sector to see how the private sector can complement the intervention of the public sector, obviously in a way that contributes to universal health coverage and to reduction of inequalities. So these are some of the key messages I wanted to share with you. Thank you very much for your patience, and I look forward to a very productive conversation.
Jeremy, excellent. Thank you very much. Very interesting. I particularly like your mentioning that better health through life course intervention is possible. It's not only possible, but it's an excellent investment. And coming from the World Bank, that is powerful. I'm going to change to Spanish now. I am just delighted now to mention our panelists. We are going to have an informal chat and this will be moderated by Agustina. Let me tell you who are the panelists. We will have Dr. Gloria Giraldo, perdón, estoy cambiando de idioma, ¿no? Quería hablar
Sorry, I was speaking in English, right? I'm going to speak in Spanish. And yes, so we will have Gloria Giraldo, who is the representative of the Pan American Healthcare Organization. She works in politics. She has a PhD in public healthcare, and she has researched a lot in this area. And now she is an advisor for the Caribbean region. Then we have Dr. Alicia Ferreira Maia. She is a doctor specialized in managing health services and public healthcare services. She has a master in healthcare policies, and she was manager of the healthcare services of Uruguay. She is the director of the Fund of Resources of Uruguay, and now she is teacher of healthcare, and also she is the technical advisor on health policies for Home of the Representatives Deputy Cristina Lustemberg at Uruguay. The next speaker is Jaime Barba, and he will talk about the experience of what it is to live with an ENT. He has been a leader of programs of NCD Alliance, and he collaborates with CLAS as well in a group of people that live with this kind of disease. He has lived with EPOC. It's a respiratory chronic disease, and he has experienced this firsthand. The fourth speaker is Ana Ragañaga. She's a coordinator of political incidents of the Contrapeso organization in Mexico, and she's expert in nutrition, food policies, disease and disease prevention. She also was the first coordinator of the Young Alliance, also collaborates with CLAS, and she participated in she also participated in NCD Child. And we're going to be launching a research made by Anna soon about marketing through social media. Maybe she will talk about this, or you can research her work if you're interested, or you can keep up with the research, this research that we will be publishing soon. So I am going to be, Agustina, you can take the floor. Thank you. It's great to moderate this panel, and it's great to have different perspectives from different sectors and countries to talk about the UHC in our region. And I think we will have excellent contributions from all the members of our panel. Let's start. We will start with Gloria. Gloria, how does the financing gap in our region and how it affects the services for NCDs? Usually in our regions, plans and strategies are adopted to implement the UHC, and what kinds of assessment should be needed to build evidence at a regional level? Could you share examples of another countries and how this is having an impact? Thank you. And just to balance everything out, I will speak in English.
Very humbled to be in the company of such a remarkable panel. So thank you very much, and greetings from the Pan American Health Organization. We're very, very honored to be sharing this space with you today. So Agustina, your question is a really, really important and heavy question. I had some in my preparation and some notes. I wanted to bring back, even though I know some of us have been working on how do we overcome the last 3 years that we lived. And of course, I'm referring to, we just went through one of the most historic times for all of us, going through the pandemic. And I'd like to bring that back because it will relate back to the overall thrust of your question. So I'm going to place, just for accompanying some of my reflections and comments, a few slides on the screen. We won't go through this as a per se as a PowerPoint presentation or academic presentation, but did want to share some data, because that is a very important part of our work. And of course, we've just gone through this incredible 3 years of the pandemic. And one of the important areas of work currently is that we look back and try to understand what were the capacities of our current systems, what were the weaknesses, and how can we look forward, and and among those assessments that we look to that we need to conduct is also understanding how did our systems work, what do we have been able to do well responding, because this was truly a test. And today we've heard the different panelists speak about universal healthcare coverage. And where does that take place? Where does that become concrete for the people in our communities? Well, we've also spoken about primary healthcare. And this is where it concretely comes, that person that is needing that care when is not feeling well, when they're are needing to find out whether they have an NCD, such as diabetes or hypertension, for example. So very quickly, just we've conducted a study of how did we fare? And it's not, we all lived through it. So we knew that there were some of the disruptions that we encounter. We know that many of these NCD services, of course, such as cancer treatment, hypertension management, diabetes management, and complications were absolutely affected. However, some of the data is also showing that we had a diversity of responses, and this gives us the signal that whether there's so much to do, there is also some strengths within our systems. One of the major sources of looking back at how we fare during the pandemic is the WHO Pulse survey that has been conducted 4 times, and more recently showed that there were still some persisting service disruptions across healthcare settings and service platforms, some had to do with supply sector side factors, including low levels of care seeking, and also, of course, with the health workforce, medicines, and health products. So those are areas that we still need to work on. We know that several of our countries had increased backlogs across many tracer essential health services, such as hypertension as well, and others for screening, cancer screening, and other treatments of non-communicable diseases. So that is one aspect, which is studying how well we fared in the past. And I want to wrap up with a couple of points. One, we also had important lessons. And if we're going to advance in strengthening primary care, if we're going to advance with universal healthcare coverage, there were some silver linings during the pandemic that are important to rescue. Some of the systems were more agile at triaging and identifying priorities. The introduction of telemedicine deployment was also an important step. And in some other countries where there's geographical isolation, this is an area that we want to, or even difficulties due to transportation and other barriers. The redirection of patients to alternate care of sites, reorientation of referral pathways. It's also an important outcome that functioned as an emergency measure during the pandemic. And I want to underscore also novel dispensing approaches for medicines. This is so important because, as we know, chronic conditions require that chronic care, and medication that is dispensed for at least 3 months has a very important impact on our patients that may have different barriers in accessing care. Finally, task shifting and team-based approach. So primary care that is centered and focused on a primary care team approach is where we need to move, and the pandemic really gives us a push towards that. I will be happy to address some other components of your question, but I don't want to overstep in our colleagues' time. But in regards to assessments, I just do want to say that as we move towards that universal healthcare and the strengthening of primary care, there are lots and lots of elements and tools that both WHO and PAHO have designed and are there for the utilization of ministries of health, civil society organizations. There are different ways of measuring and assessing how we're doing towards those, towards our goals, and the way for civil society to keep us accountable and keep ministries of health accountable. How are we progressing? And I want to close by this visual that to me speaks volumes, which is that we have, through the international multilateral organizations, including the World Bank and many other entities, designed excellent guidelines, and we have excellent declarations and statements and support and plans. But as it was previously said by one of the panelists, if this is not implemented, we won't see any progress. So we really need to create dynamic platforms to implement, and how do we incorporate what we just learned from the very important historic 3 years of the pandemic, how NCDs were addressed during that period of time, what were the weaknesses, and how we look towards the future to incorporate the lessons and continue strengthening the work that was done. I will leave it as that and happy to continue the conversation.
Thank you, Gloria. De nuevo, la importancia de la implementación, ¿no?
So we're talking about again about the importance of implementation. It is key. And now we're going to give the floor to Dr. Alicia Ferreira. I would like to ask her about the work that is being done in her country to improve the healthcare benefit packages, and how has she been working with other actors such as social civil society. First of all, I would like to say thank you to all of you in the name of Cristina Lustemberg. Right now, she is presenting a draft bill that we elaborated in her office, that it's oriented to prevent NCD through rules about food security. So it is great to be here to talk a little bit about the experience of Uruguay. So I will make the most of these minutes to answer your question. And to present this model, well, this the Uruguayan model has 3 dimensions. So Uruguay has a healthcare expense of 10.5% of the GDP and the public expenditure of 6.9%. And the 16.9% of this healthcare expenditure is out of the pockets of the citizens. In 27, our healthcare system was created, and as Gabriela Cuevas said, we need political will to achieve the UHC. We had it in 2005. That was a very important step to create our healthcare system. And this legislation had an objective to reach UHC and also the economical stability of the system. Through the creation of a healthcare fund, we offer a quota to the people that's integrated in the system. That depends on the achievement of assistential goals. And these, they're linked, some of them are linked to the prevention and monitoring of NCDs. And as a part of this integrated system, the healthcare system implemented a benefits plan that it's called Integral Healthcare Plan. And it considers the obligatory contributions, and it includes a formulary for drugs, and this system needs to be secured for the whole country. So we have the transfer from the fund, and also this finance the benefits plan of our country. We also have the National Resources Fund. I was working there a couple of years ago, and it guarantees the universal financing coverage and also it covers high-priced drugs and medicine. This is mainly public. And so, among the benefits of this, we have, for example, treatments for heart attacks, for heart diseases, chronic disease, and also it funds high-price drugs for diabetes, different kinds of cancers. This fund also funds treatments for obesity and tabacism. So people can access to these benefits that are part of this integral healthcare plan. People that benefit from private institutions need to pay a copayment, like a ticket. But these tickets, so to speak, are regulated by the economy ministry. So there's a ceiling to these prices. They're regulated. Also, I wanted to highlight some decrees were approved that allow that some of the benefits that target NCDs are exempt from copayment. On the other hand, these benefits are offered periodically through reviewing processes, and in Uruguay, it is not needed an active involvement of the civil society as it is asked in other countries. Thank you. Thank you, Alicia, for your presentation. It is great to see how governments are taking these goals, are actually transforming them into realities. We also, now it's Jaime's turn. So could you give us a little bit of your perspective and how the lack of investing in NCDs affects you and your community, and how the significant participation of people like you can help to solve these problems? Thank you to the NCDA Alliance for inviting me to be part of this, and also thank you to all the participants in this forum. So according to La CEPAL, the healthcare expenditure last year in Latin America was below 4% of the GDP. And we were living a pandemic. This percentage is very far away from the 6% that it's recommended and asked by the WHO. And this is contradictory with all the conversation about UTC, not leaving anyone behind. Because this percentage is not enough to cover all the needs, to meet all the needs of the people like me who suffer and who live with these diseases. Thousands of people, or for example, me, we're privileged. Me, for example, I can absorb the cost of these disease. But for every person like me, there are a lot of people that do not have money and that end up spending all their family patrimony trying to overcome diabetes, cancer. And at the end of the day, they lose everything. They end up losing. They spend everything they have in this, and at the end of the day, they still lose their loved ones. These diseases are very long and they cause a lot of suffering, poverty. It kills us very slowly. And sometimes in Latin America, 1/3 of the country, I think 40% of the healthcare expenditure is out of the pocket of the families. It does not come from the healthcare systems. This is a very acute, a very serious situation. We're directly affected. I am focusing a lot on economy. As Gabriela said, if a politician that talks about healthcare, we would need to, when politicians talk about money, we should tell them, okay, show me the money first, as Jerry Maguire said in a movie. Because sometimes we do not know if politicians really care about it, or if it's just a facade. A month ago, the WHO published a charter about the significant participation of the people that we live with NCDs. And I am honored to be a part of the NCD Alliance since 2017, where we published a charter about the rights of the patients. And now I am very proud to say that the seed that we put on the ground 7 years ago, it's already being fruitful. It's very important for us people that live with an NCD to empower ourselves. That document, it's very important, and I encourage all of you to read it, to study it, to work with it. But as it has been said, it is very important to observe the details closely, to see where money is finally put on, how money is allocated. And it's there where we, as people that live with an NCD, need to be observant, to look around, to be always prepared to ask for and demand for our rights. We need to be aware of our power. Our voices are starting to be raised. Now the people all around the world that live with an NCD are starting to be heard. Last year, here our voices were listened by the representatives, and we're starting to have some political influence. But we just started. These are the first steps. We're just putting our feet in water, so to speak, when we should be diving in the sea. We, the people that live with an NCD, we do knock on a lot of doors. And I encourage you that if we knock on a door and it doesn't open, we should just open by force. Because at the end of the day, the healthcare system belongs to us. Thank you. Thank you, Jaime, for your words. It's always a pleasure to hear you talk. If you allow me, I would like to have another minute and to share a fragment of a song from Silvio Rodríguez.
Degollaron su alma en nuestras manos. Absurdo suponer que el paraíso es solo la igualdad y las buenas leyes. El sueño se hace a mano y sin permiso.
is reading. He's reading the lyrics of a song who basically talk about taking justice by your own hand. I think the people like us who live us with an NCD, we need to keep fighting. Thank you, Jaime. Well, and now finally it's Anna's turn. Anna, I will ask you to talk about how you work with other sectors to accelerate progress of healthcare in Mexico. And I would be very grateful if you could give us some specific cases and examples. Thank you, Agustina.
I'm going to speak in English because I had already told the translator, so we're going to switch it up a little bit. But thank you for having me in this space. I am really honored and really inspired after hearing Jaime, especially with that closure. So what I could say firstly is that over the years, I have had the opportunity to collaborate with different civil society groups and organizations, and I have been part of collective efforts to demand improvements, particularly in prevention and care of chronic diseases. And I could cite wonderful examples that I have been part of by working, for example, with the Contrapeso Coalition, which, as Beatriz mentioned at the very beginning, has promoted effective measures such as the special taxes on sugary drinks in Mexico. And then further in 2019, the approval of law reforms to implement a warning labeling system in ultra-processed products and sugary beverages. Or I could talk about the Mexico Saludable Coalition, who we all know and love, and they are great promoters of multi-sectoral alliances, and they have a lot of valuable experience linking with government to promote a lot of regulatory measures on harmful products, such as tobacco products, new tobacco products, alcoholic beverages, and even trans fats in industrialized products. So I have sort of learned from incredible platforms like this. They are very active also in promoting an agenda of universal health coverage, and they have also been amazing at integrating, and not just integrating, but actually making the voices of people living with NCDs a central part of their work and putting their experiences first. So I think that being part of my mentorship, sort of growing up in the world of NCDs has been amazing. So I'm really proud to have been part of both these coalitions in the past, and also just to be able to share with such admirable and caring people.
Now, so sorry to interrupt. Your video just froze for us.
Oh.
So maybe you can try turning your camera on and off again to see if that works. Okay.
Is it working better now? Okay. Thank you. Thank you for letting me know. And I'm so sorry. I hope my internet is not causing a lot of problems. For some reason, this morning it is. It was working perfectly yesterday, and you know how these things go. But okay, so I'm gonna come back and talk about another effort that I was able to be part of more recently. And this is the NCD Child Young Leaders Program. And this is where the multi-sectoral collaboration comes to my mind. So this opportunity was given to a group of young people from all over the world. We actually became friends and shared a lot of interest of NCD prevention and care. And this comprehensive program, as part of it, we received regular mentoring sessions, you know, attention and follow-up from a particular mentor that guided us in our path as future health leaders. And as part of the second year of the program, we even had the amazing opportunity to develop a project of our own. So a lot of young people from across the world started to propose what sort of projects they had in mind. And you can imagine the creativity was amazing, and the amount of projects that were supported I would invite you to actually get to know them and to visit NCD Child's website to know a little bit more about them. So I'm gonna just take up space to talk about two things. First, the importance of linking prevention policies with the UHC agenda. And second, the need to include young people in these efforts. And this is linked to the project that I pitched and actually developed, but why linking NCD prevention with UHC, right? When we are talking about implementation and budgeting and actually being able to access care when you need it, whenever you need it. And I think it's very basic and we all know it, but it seems like it doesn't happen at the same time. And sometimes it feels as if governments sort of choose between either preventing or either treating, and it has to be both, because absolutely there is no chance that a public health service will be able to bring effective attention and quality attention if the rates of NCDs continue to grow as they are growing right now. If we do not sort of close the door on the growing amount of NCDs, UHC attention will be affected, will be impacted, and it will be impacted negatively. And there is also, you know, a lot of figures and numbers that talk about the impossibility for many governments, not just in the global south, but also in the global north, the inability for governments to actually cover for NCDs if they continue to grow at these troublesome rates. So prevention has to go hand in hand with UHC policies. And I think, you know, at discursive levels, we sometimes hear these two things as separate things, as you either do prevention or you either do attention. But as long as we continue to watch them separately, I think the results that we will be able to see are still going to be partial. And about the inclusion of young people, well, firstly, I think young people are at the incredible stage for prevention. Especially if you are thinking about children. So targeting prevention efforts at the national levels, focusing children and youth, is a very, very effective strategy to go, right? So I'm going to talk very, very briefly, just to set an example, about the project that I proposed and that was supported by the NCD Child Young Leaders Program. And I'm just gonna, I don't know if you can see my screen now, but this is going to be really, really quick. It's just a couple of slides to talk about how this amazing opportunity supported not only my project, but also the project of many other people. There's a project supporting cancer, young cancer survivors in Australia, mental health problems in people in the Caribbean, you know, projects focusing on type 1 diabetes in Brazil. So please do get to know the NCD Child Young Leaders Program projects. And for the project I developed actually in doing research into countries that were Mexico and the United Kingdom. I did a research, a digital ethnography, documenting how influencer marketing in digital spaces is targeting children and youth to advertise, to promote, and to sell higher amounts of unhealthy products, such as tobacco products, such as alcohol, and such as ultra-processed products. So derived from this work, we did not only did a report documenting a lot, and I mean this in a very, you know, worried tone, because there were a lot of marketing efforts that we saw in digital spaces that are not covered basically by regulations, because regulations currently are more focused on traditional media communication channels, such as radio, such as TV, such as cinema, or billboards in the public space. But it seems that digital spaces and the metaverse and these new spaces that technology is bringing into the table are not yet covered, not in Mexico, not in other countries that we could think maybe are more advanced on a regulatory level, such as the United Kingdom. They are simply not. And so young people involvement in monitoring these spaces and in denouncing how these spaces are becoming sort of an invitation to consume products that are putting us, young people, at a greater risk of developing NCDs, I think it's really important. So we also developed a policy brief. We want this policy brief to be very useful for, policy makers, for decision makers. It's going to be in English and in Spanish. It's very broad because it's not, it's very, very broad recommendation, but the emphasis is put in prevention. And again, I'm trying to circle this with the UHC agenda, right? We have to continue to link these efforts to tell policymakers, you also have to protect young people from the greater risk that these products pose for their health, as well as to guarantee access to UHC for the entire population, particularly those at most risk of developing NCDs. So I'm gonna stop sharing screen now. This was just a brief example, but I think this is sort of, the value of including young people into the conversation. Young people are also patients living with NCDs. There's still, I think, this sort of mindset where NCDs are something lived mostly by a population of older age, but that is simply not true. NCDs affect young people as well, and they do so in the whole world. So engaging with young people and having young people also demanding stricter and better policies, regulatory policies, I think it's a great way to complement UHC policies. So I would leave it at that for now. Thank you.
Thank you, Ana. Muchas gracias.
Thank you, Ana. Thank you for your interesting contribution. It's been very interesting to listen to your approach, and I really liked these reports, and I hope many people will follow its launching. Well, we have been listening to excellent contributions of this panel, but now we have the opportunity of making some questions about strategies, about this issue. And now it's your turn. Now you can ask the questions that you want. We are going to be using the functionality of raising your hand. And if you have any question, you can push the button to raise your hand. We will unmute you. I will be facilitating this discussion, and I will ask you that when you ask your question, doesn't matter which language you use, you speak slowly and clearly to ease the interpreter's job. So please feel free to ask the questions that you want. Is anyone interested in asking any question? If not, we will wrap up.
Vamos a comenzar con esta pregunta. Mientras que piensen y levanten sus manos, voy a leer esta.
I'm going to be reading one of the questions for.
Could you shed some light on the role of civil society in effective advocacy for the prevention and control of NCDs to achieve universal health coverage in the region? No sé, ¿quién de los panelistas les gustaría? Sí, adelante, Alicia, por favor.
Sí, quería justamente responder.
Yes, I wanted to make this and make the most of this and say the participation of civil society in my country to achieve UHC and to treat NCDs has been extremely important to achieve all these changes. Of course, there was a considerable political will of the government from 2005 onwards, but of course the role of civil society was very important as well. Taking in account the dimensions of our system, we could say that Uruguay achieved the, let's say, the population dimension, because all population has access to healthcare. But in the case of financing, we could also say that yes, but in the case of benefits and packages, it's been some years, due to the pandemic, that the benefits that are included in the healthcare plan have not been totally included. Let's say we have not implemented all the new or not so new technologies and treatments. These have not been integrated. They have not been included in the integral plan. And so its price is not regulated when it comes to co-payment or tickets. So paying or covering these kind of treatments can be difficult to part of the population. This is one of the problems that we have in our system. Thank you, Alicia. Do any of the panelists would like to talk?
I really appreciate all the presentations, and especially Ana, of course, Jaime as well, and Alicia. And Ana mentioned some very important elements around this differentiation between care and prevention, and just reminding us that UHC implies that all people have access without discrimination, nationally determined to set needed promotive, preventive, and curative. So that whole promotion, that whole upstream work is already included. And regarding your question, you know, the civil society and examples, we have great and vibrant examples all throughout our region. That is incredibly exciting to, you know, from Argentina all the way to Canada and in the Caribbean. I do want to mention actually an organization, part of NCD Alliance as well, the Healthy Caribbean Coalition, that with mobilizing their youth, mobilizing their elders, mobilizing entire communities, they have been able to put to make great strides towards the front of package warning labels. And this is a more upstream, but as much as we have to work on the improving primary care, we also have to work into creating those healthy environments that once people have been to their primary healthcare center, once they've seen their doctors, once they've, you know, released, they go home, they also go home to an environment, to a supermarket, to a small tiendita, to a small place where they buy their food, and they are finding that they have better information on the type of food that they're getting, that is accessible, that is healthy. So this movement of engaging children and youth and people throughout these coalitions, and not one organization in one country, but over 100 organizations under an umbrella, I think is a very powerful model. And as Ana also alluded to, and also Jaime, is also, you know, using technology to link all those experiences that before were isolated experiences of people living at home with their chronic condition. Now those people can be, you know, these communities are weaved to create change. So I wanted to bring that example of front of package labeling and the work here in the Caribbean by the Healthy Caribbean Coalition. Over.
Muchas gracias, Gloria. Veo que Leslie Ramírez tiene la mano levantada. Le voy a pasar la palabra a
Thank you, Gloria. I'm going to be, Leslie, you will take the floor, but I see a comment of Ingrid. I think it's related to the policy briefing, and it's asking if she could have access to it. So I think Anna could be sending some information about it through the chat. Is that possible? And please, Leslie, you now take the floor. Good morning. Thank you for this space and for all the presentation. And thank you also for your insights. I would like to talk about something that I think it's essential, especially for our region, because when we talk about healthcare in Latin America, we see that the gaps and difference are too much. Some of the panelists have been talking about 40% of out-of-pocket expenses. In Guatemala, it's the 52%, accounts for the 52%. The systems are extremely different, and in countries like Guatemala, the discourse, and yes, I was checking the PAHO profile in Guatemala, and yes, we have different efforts to improve primary care, but as it was said, the political will always reflect on the budget. And in the last 40 years, healthcare has only accounted for the 1% of the public budgets. So if we do not have this specific political will, everything is just, let's say, empty words. So in these kinds of spaces, I always ask myself when we talk about UHC, how can we achieve, how can we make our countries to show a real political will to change, especially when it comes to UHC. Also, it is very important for this to achieve this, to end corruption, to have an efficient managing. And sometimes in our countries, the discourse is very sovereign, even when it comes to buying medicines. And we ask ourselves, how is that possible? So I think it is very important how we can create this political will. How can we make obvious that some countries just have empty words and not real plans and not real budget, or have very beautiful plans but do not have the will to advance? Especially in our situation, we are one of the countries in Latin America that has the most percentage of chronic diseases, and we don't have an effective way of fighting against this. Also, public policies depend on institutional stability. And in our countries, health degrees are still a dream, and our governments cannot advance because we not have instability. The mandates of our government change every 4 years, and this happens at a national level, at the level of the Ministry of Health, but also at a local level. Every 4 years, the staff changes, and so it is very difficult for these plans to actually be implemented. Moreover, it is very difficult to think about strengthening our systems and reaching UHC when we have a country that lacks 300 professionals in primary care. and we do not have, at a political level, a will to invest in healthcare infrastructure. Luckily now we have a loan from the World Bank to improve this structure, but it's not enough. So what can we do? These countries with more deficiencies, so to speak, what can we do? How can we create this political will? We need a realistic budget. Thank you, Leslie. I don't know if any of our panelists would like to make a comment. Well, I think talking about averages, New York would have the best temperatures in the world. 0 degrees during winter and 30 and 40 during the summer. And this perception also happens when it comes to healthcare systems. We need to establish what is the minimum. The minimum is in the rural areas where people do not have an easy access to healthcare. And the situation in Guatemala, it also happens in all the countries of Latin America, in the smaller regions. We people that live in the cities, we have better access. But in the Amazons or in the Patagonia, when one starts looking for access, one realizes that it is very difficult to access healthcare services. I think we need to allocate more money in the first place. We also need to have a different governance within the healthcare system, a governance that prioritizes beyond political will. In 7 years, we have had here 3 different UHC systems, and the first is not even consolidated when the second is proposed. And we do not reach our goals. And lastly, we have accountability. And that's why people with NCDs like me, we need to be attentive. We need to raise our voices. We need to go to the government and say, what are you doing? We are paying our taxes. We need your help. I think if we achieve these 3 things, the healthcare systems are going to be working better for us, not figure-wise, not statistics-wise, but at least better for us. Thank you. We would need to wrap up because we should have finished 10 minutes ago, but Ana, yes, sorry, I was not aware of the time and I wanted to answer the question. I think I would add, I don't know how to do it exactly because I think many countries in this region were still like on that track. We don't have a final result, so to speak. We are not at the end of, let's say, our journey, and we cannot see yet the steps that we have followed. But I think in Mexico, we have very interesting examples. for example, during the elections, questioning directly the candidates to the government of the country, also campaigning, asking specifically politicians which were their proposals in care and healthcare. And so I would recommend you to check the work that the Mexican coalition has done. That is checking really closely which were the proposal of the different candidatures of the government, questioning it. So in order to inform our votes and to see which candidates are not willing to do any changes, positive changes to the healthcare system. I think this could be very useful. Of course, it's not enough because, as Leslie said, we have in this region very serious corruption problems, and we need to create better alliances in this civil society. We need to start weaving these nets that allow us to monitor better, more and better, the political decision-making in healthcare. I would add that. Thank you so much, Ana. Okay, I see that Gloria also sent a chat, and Ana also answered one of the questions, and to be respectful of the time of everyone, and because we do not see any more raised hands, I am going to be closing the session, and I'm going to be giving the floor to Beatriz before finishing. Go, Beatriz. So, thank you all of you for sharing your insights, both the participants and the panelists. I am very surprised for this rich insights that have been shared. I just like to make a couple of points, some highlights, because I think everything has been said. On the one side, I think some of you mentioned the experiences of people, of putting people in the center of these systems. Because we don't need a system that does not respond to the needs of our people. This was mentioned when Jaime intervened. It was mentioned when it comes to meeting the needs of children and small girls. Also to guarantee the participation of young people. I also thought what Leslie shared was quite interesting. And she also highlighted putting people in the center. These people that are impoverished by healthcare expenditure. And it's not people that cannot access healthcare because they're poor. They are poor because of the access to healthcare. And so we need to demand our rights, understand that healthcare systems belong to us. Another thing I would like to highlight is the importance of implementation. I used to have a mentor, Dr. Chagro, that said, oh, we are all day creating, publishing, drafting declarations. Gloria said the same. Yeah, we already have lots of plans. But what it is important is implementing, involving different sectors, and we do need that. Alicia also mentioned that the representative of Uruguay could not be here because she is in the Congress trying to pass a draft bill. So implementing has a lot of value, and from our region, we know about it. We're aware of this. And finally, I would like to talk about the importance of the chance, of the opportunity, because we do have a lot of them, even if we also have lots of problems. We have the chance of informing about how this is a great investment. I think Gabriela talked about this at the beginning of the session. We do think about healthcare as a cost, but the pandemic taught us that we can be destroyed, that our economies, that our societies can be destroyed by a healthcare problem. And I consider that sometimes people do not realize what the reality is even after the pandemic. But let's remember that this pandemic taught a lot of things to us. I really like the comment that Gloria said about the pandemic made us think about our weaknesses, and we ended up making up very, very important and positive changes. And even if the pandemic has caused a lot of suffering, has also given us a chance. And Leslie, I wanted her specifically to come to this meeting because she has a great experience in citizenship mobilization. The mobilization of people in towns, in rural areas. And you also talk about this citizenship mobilization and about accountability from citizenship. I think this is a great chance. Actually, we're working in CLAS in a program called Saludarle Saberlo, trying to improve our communications. Because sometimes we do communicate too much, but we do not convey too much. But this is not communicative about healthcare. It's also nutrition. It's also communication. It's also environment. So we need to learn to communicate how UHC is linked to the problem of having a healthy planet as well, of having better education in our countries, how all of this is connected. And I would like to finish by saying how accountability and the mobilization of the population can also increase the budgets, because budgets do not increase randomly. They increase because pressure from society. And so if we want to increase healthier budgets, we need to organize ourselves. I would not like to extend myself more, but I think this session has been a great experience, and I would like to say thank you to NCD Alliance for giving us this opportunity to our regions. And also say thank you to all the panelists, and of course, thank you to all of the participants for joining us. Thank you so much. And I say bye to all of you.
Muchas gracias.